Welcome to Diplomacy at Risk. This is a program series which looks at the current risk to American diplomacy, its impact on the American people, and what can be done about this issue. Today's program will focus on global health and biodefense. Both of these issues are increasingly important to the international community and to the United States. Several trends in the world today, population growth, urbanization, climate change, and migration, are increasing the likelihood that we will experience an uptick in the frequency of infectious disease outbreaks across the world in the 21st century. Globalization has made the world a very interconnected place. And what happens in a small country, for example, in West Africa, affects all countries, including the United States. So today we are going to look at the role of diplomats, the role diplomats play in addressing these threats, and how diplomats plan and strategize to protect American health. Our guest today is Ambassador Nancy Powell, and we're very glad you're here. Welcome.
Thank you.
And to start our discussion, I think it'd be interesting to talk a little bit about your background and how you got interested in the Foreign Service and decided to join.
I grew up in Iowa, and I was a school teacher teaching high school social studies for 6.5 years, and in a town of 900 people. So in the summertime, I quite often left to seek a little bit of adventure and see the world. And one of the programs that I signed up for was a US government program that took me to Pakistan. And I found out about the Foreign Service. And I saw a group of people who were clearly enjoying their work, providing a service to the American nation, and was lucky enough to pass the test that year and to be taken on in 1977.
Great. That's a big switch from Iowa.
It was a big switch at that time. I think I was a minority candidate in the respect of there weren't very many of us from the Midwest. There also were not very many women at that time, so it was a bit of an adventure. And I joined the Foreign Service and went all the way to Canada for my first tour.
That's interesting.
But I then went on to spend most of my career in South Asia and in Africa, which I enjoyed very, very much. I thoroughly enjoyed the challenges of the developing world and the role that America was playing in helping to improve people's lives, their governance, and had a very, very pleasant career for 37.5 years.
And a very distinguished one. As ambassador 5 different times, which is quite an accomplishment.
Thank you.
But a couple of times you worked on the avian flu influenza, and you were called back from retirement to work on Ebola. Could you talk a little bit about those experiences and the role diplomats played in responding to those two pandemics?
My own role was partially as a result of being available. I was between assignments when the avian influenza pandemic in 2006 and 7 started, or 5 and 6. And then I was in retirement when the Ebola outbreak occurred. But the embassies in both Europe and Asia, where the pandemic took place, and then in West Africa, were our alert system. They were the canaries in the coal mine, noticing that something was happening in their countries. It was not ordinary. I actually had been in Ebola or in Uganda when there was an Ebola outbreak, and they managed it quite well. But it was clear in West Africa, and the embassies were reporting this. They also were monitoring what the World Health Organization, other international groups that are responsible for also monitoring, were not picking up on it. So they really were the alert system. They then worked through the State Department to alert the entire U.S. government, and particularly for Ebola, it was truly an interagency team. The U.S. military was involved, the Centers for Disease Control, the National Institutes of Health, USAID played a huge role, State Department played a role. As it spread and we had the cases in the United States, our state governments, you learn a great deal about federalism all of a sudden when the outbreak occurs in the United States, and to realize that the health agencies are primarily at the state level, the county level. So it was a real intergovernmental effort. And then the international effort particularly for here in Washington, we were working with the President's office, with the Secretary of State's office to encourage our allies to step up. Money, doctors, support for the World Health Organization, for the UN effort. But we were also part of the team that looked at what was happening. We were watching what was happening in Liberia. Was the outbreak of Ebola going to have political consequences? It was a very difficult time as Liberia was emerging from its own difficulties. And so a variety of roles were played. My own role was more of a team captain. I had an interagency and a very diverse team that put together science, knowledge of international affairs, and also working with the NGO community to get them to help us staff the clinics in West Africa, but also coordinating with the Canadians, the French, the British, others that are natural allies for putting personnel and expertise on the ground when this happens.
I guess one follow-up to this is, how about your coordination with the United Nations, specifically WHO, but other UN agencies that were involved as well?
In the avian influenza outbreak, the WHO really took the lead. And one of these things that happens quite often in the Foreign Service is that the colleagues you met at avian influenza turned out to be the UN colleagues that were working on Ebola. So we already had a working relationship. We knew each other from the earlier effort, and that made it much easier. There was among the Americans and the UN, there were 5 of us that had been in Nepal together. It had nothing to do with Liberia or Ebola, but those personal relationships allowed us to move very quickly into a working relationship that worked. I think out of this, we understood that WHO in particular needs to have some reforms done. They are working on those. They did a very, very thorough study of their own efforts on Ebola, which frankly were a little bit late. And so the US and others that participated helped with that critique and has tried to work through the UN to say, when the next ones happens, let's be ready on the international front.
So it's clearly the United Nations played a leadership, or I mean the United States played a leadership role in working with the WHO and the governments, more than other countries.
I think particularly on the Ebola outbreak, our longtime relationship with Liberia played a role in that. We've had this relationship since the 1800s. It's a very special relationship. So that played a role. But we also could get off the ground. The US military was able to take doctors, to take materials in to build the clinics that needed. And we also had people on the ground that understood that the culture in East Africa, where I had been when there was Ebola, was very different than West Africa, and to help to shape the programs. There were different funeral practices. There were different public health concerns. The population was much more mobile in West Africa than it had been. So trying to follow an infected person was much more complicated in West Africa. It went across 3 borders and trying to do that, but it was absolutely necessary. And the embassy people had the context for the scientists and the health workers that came from CDC or from NIH to say, yes, this is your message, but if you say it this way in West Africa, it will convey and get a more positive response. If you say it this way, maybe not. And so that's a very important role for the expertise that the embassy brings of what kind of public messaging will work here. What's the literacy? Do people listen to the radio? Do they do texting? Do they have television? How do we get that message across about how dangerous this disease is? But there are ways to counteract it. And so that was a very important part of, again, the interagency, but using the expertise on the ground of people that understood Liberia or Sierra Leone.
Yeah. And I guess a variation on what you've mentioned a little bit earlier, how did the State Department and the embassies react differently after it arrived in Texas?
obviously there was a great deal more interest than there had been up to that point on the part of the entire American population. I think all of us were a bit amazed at how much panic there was in the United States and a lack of understanding of, despite best practices and explaining how difficult it was for Ebola to be transmitted, that there was a great deal of panic. And we also found that our hospitals were not quite as prepared to deal with it, so there was a big training. And we took some of the materials that had been prepared for Liberia and adapted them for American hospitals of how to put the gear on and how to make sure that our doctors and nurses were safe. And but it also was a lesson in federalism, as I said. And all those who traveled in that part of the world were being followed by temperature checks for 21 days. And so there was a lot of learning of how intertwined the world was. As you said in your introduction, you begin to really understand how well linked we are when how many people are coming from West Africa, what are the transportation routes, and how do we make sure that people can do it safely.
My guest today is Ambassador Jimmy Coker. Welcome. I'm glad you could be here with us today.
It's great to be here.
And you've had a very distinguished career in the Foreign Service, and I was wondering if you could talk a little bit about how you got interested in the Foreign Service, your background, and that sort of thing. What led you to become a Foreign Service officer?
Well, I grew up in the suburb of St. Louis, Missouri. My mother lived in the same house for 44 years, so I did not have an international upbringing at all. But when I graduated from college, I got a fellowship that let me go to Africa for a year. When I got back, I was looking for someone else who would pay my way back to Africa. And I thought it was a lark. I thought I just needed to get it out of my system. But I discovered when I went to my first post, Mozambique, that I actually loved what I was doing, that they were paying me to travel around the world, to talk politics, to write about it, to meet new people, to change jobs every 3 or 4 years. And it turned out to be a terrific career.
Can't beat that. That sounds great. But in your career, you also went way beyond the State Department. You worked for UNICEF, you worked for, you were an Assistant Secretary of Global Health for HHS. And could you talk a little bit about the different jobs you've had that related to, with a focus on Ebola, and you did some work as well on HIV/AIDS and that sort of thing?
Right. It was really the President's Emergency Plan for AIDS Relief, President Bush's program, PEPFAR, that got me thinking about global health, because Uganda was the focus of this $15 billion program that was not just a pilot program or center of excellence. This was national scale up. We were trying to reach everyone in Uganda, hundreds of thousands of people who needed help in order to fight the HIV and AIDS epidemic. And I realized as ambassador that there really were two worlds, that we knew the science. There were people in the United States taking drugs, getting better. What we didn't know was how to apply that to the kind of program that we were undertaking in Uganda. And I realized that diplomats had some skills. There were scientists or medical people saw a problem, they did the research. If the evidence was good enough, they published the results in a peer-reviewed journal, and they'd solve the problem. But for a diplomat, that was just the beginning of the solution. You really had to figure, how do we put this evidence onto other people's agendas? How do we get a society that's not like ours, that doesn't read scientific journals, to apply what we know as the best practice? And so I realized that although it was a very small pond, the world for health, the opportunities for health diplomats actually were very important and very promising.
Ah, yeah. And if I could just follow up on that, because you've worked on AIDS, you've worked on Ebola and Zika, and while you were at HHS, or Health and Human Services, and each of those were a little bit different. But it strikes me that PEPFAR was the biggest different sort of response to these kind of pandemics. And if you could kind of compare and contrast those, it'd be interesting in how we dealt with them.
PEPFAR was a very ambitious program. We're using it now in the same sentence with the Marshall Plan. This is what America can do in the world. This is what we stand for. It's what we're best at. And it really was a successful program. We took on a huge challenge of a disease that was killing millions of people and said, we're going to reverse this. And PEPFAR, in the lead with many, many partners, has done so. And what that needed was not just presidential leadership, not just the energy that the US government put by making an interagency process, not even just the money, although that was essential, but what we had that no one else could bring to the AIDS epidemic was the global reach. We were in all the places we needed to be to do this kind of national scale up. And that is an amazing accomplishment. I think when we look back at what we've done, we can be very proud as Americans that we had this opportunity. We were the only ones really that could pull it off, and we did. And that is a fantastic feeling. If you're part of the US engagement in the world, this is something we can point to. I think Ebola was a little bit different. Ambassador Powell's on the same program, and she explained very well that the countries where Ebola was taking place had special needs, and that the US was able, once the military provided some hardware for treatment facilities there, we were able at the Department of Health and Human Services to staff a world-class clinic in Monrovia for health workers. But the challenges of setting that up were really staggering. The question is, where would the staff live? How would they get water? How would you get electricity in the facility? Who would secure it? Who had access to the facility? Who was a health worker? Obviously, a doctor would be the person who cleaned the rural clinic was a health worker. What about the person who did the budget for the NGO in the Capitol? Was that a health worker? What if the CNN correspondent got exposed and showed up? Would that person be eligible? An American citizen in the country. So there were a huge number of challenges in addition to training public health service officers who had important domestic assignments which were almost impossible to replace, to say, oh, you volunteered to go to Liberia for 90 days, but there's no one going to be in the US prison service to do the work you've been doing at the clinic there. So all of these problems became diplomatic problems, and the solutions were partly medical, but even more important, they were this kind of integration of what does a US response mean, and how do we put this together in a way that would work under very challenging circumstances. If this had been easy, someone would have already done it.
Yeah. And could you talk just a little bit about your interaction with the United Nations system and the multilateral system as opposed to our bilateral response?
Sure. I mean, I was the U.S. representative to the WHO in my job at HHS, lead diplomat there. And just as Nancy Powell described, the WHO failed in their initial response to Ebola. But there were 5 blue ribbon commissions, and all of them determined that replacing the World Health Organization, trying to find another international body to take over what their responsibility had been, would have been absolutely impossible. We never could get the political consensus together. So the US, in collaboration with African missions in Geneva, the Europeans were backing out because they had migration problems. Yeah. They didn't want to engage at all in trying to get WHO reformed. But the US saw this as a really last chance opportunity, that if WHO couldn't get their outbreak and emergency people to work together, they couldn't partner with non-government organizations, they couldn't mobilize the surge capacity from within their own ranks and from people like CDC and the European Union, that the next epidemic could be even more devastating. So we worked on that, and it's one of the things I'm most proud of, that with US leadership, I was the co-chair with the South African Secretary of Health on a 46-hour negotiating session to get a 74-paragraph resolution. This is what WHO has to do to be ready for the next pandemic. And we succeeded, and they haven't done everything right. There's still huge challenges, but they've taken that seriously, and they're making the effort that we wanted them to make.
So once again, the United States has played a very strong leadership role in responding to
I think
outbreaks.
People who haven't been in these meetings don't realize the U.S. is the most important member of most of these organizations. Right. We helped write the rules. We set up the organization. We're the best prepared delegation. And if we fail in that role, if we don't take the organization seriously, there really isn't anyone else that can come in and take our place to do that, or would do it nearly as well or as thoughtfully or as comprehensively as the U.S. has done historically. So I'm worried that we may be losing that edge that the U.S. provided for organizations like the World Health Organization to fulfill their potential.
Sure. It's a pleasure to have with us today both Ambassador Nancy Powell and Ambassador Jimmy Coker, both of whom were very much involved in dealing with pandemic diseases during their career. So I would like to ask you both to comment, as you were working from HHS and you were working from the State Department, how that was a bit different. They're different organizations, same long-term objective, but how do they work together and with the international community?
Well, I was the first Foreign Service officer they'd ever had in a senior position at the Department of Health and Human Services. And they really, I think, overestimated that I knew everything about how every country worked and every process that the State Department had. But even with my much more modest actual knowledge, it was a very important contrast to the way people were thinking, because they often didn't take into account how would we message this, how would this go over in the countries with who we're trying to work, and how do we leverage international partnerships. So with State in the lead, but we knew the counterparts in the health ministries and the health services of other countries in WHO, and were able, I think, really to add value to what State could do by giving the technical support.
And I think in addition to these pandemics, there's also health attachés in many of our embassies around the world. I had the pleasure of having one in India, and Jimmy and his crew at the Health and Human Services, we were actually trying to look at how to make them a more integral part of our country team, our approach from the U.S. embassies. And in India, this was a team that included both the Public Health Service and the Food and Drug Administration, the Centers for Disease Control. So the presence of the health population is growing overseas as we deal. I had CDC people there before working on polio. The eradication efforts, particularly in South Asia, had lagged the rest of the world. And so having a specialist from HHS come and to help governments deal with polio was a big plus for the eradication effort.
Many state people don't even realize that there are 2,000 HHS employees working under what's called Chief of Mission Authority overseas, working out of our embassies.
I didn't realize
500 Americans and 1,500 local employees.
Wow.
This is a major factor in many countries in our overseas presence.
Yeah, I don't think that's very well known.
No, in India, for example, many of our generic medicines are manufactured in India, so the Food and Drug Administration has a real role in making sure that they're the quality standards that we would expect. My own medication that I took when I was in India actually had been made in India, shipped to the United States, and then shipped back to me. But this was a role that the FDA took very seriously, and the Indians not always appreciated the efforts to improve, but they understood that if they were going to be international suppliers, they had to meet international standards, and we were able to help them do that.
Interesting. If you could both put your ambassadors' hats back on here and talk a little bit about the role of embassies in your country teams in responding to these kinds of emergencies around the world.
You know, CDC, Centers for Disease Control, and USAID were both essential in, for instance, the response to HIV and AIDS, but they had complementary skills. USAID can move money through contractors very effectively and can respond with to a multi-year kind of planning process. CDC is outbreak dependent. It's where did something happen today, what's that news, and how are we going to respond to that? And when I was in Burkina Faso, there was a meningitis outbreak. They wanted to cover it up because there was an international film festival going on. They didn't want anyone to know. They finally, much too late, informed the world. CDC within 72 hours had 3 infectious disease specialists there. They did the surveillance, they got the thing under control, and it made all the difference. So these are skills that ambassadors can call on, but many times we're not even aware that there are these resources, the world's best experts already on the payroll in the US government within the Health and Human Services agencies.
And as I mentioned, the early alert is really, really key. With avian influenza back in 2005, 2006, there was an effort to downplay it. Economic reasons, there was a fear that international trade would be, or travel would be cut off. And so getting people in saying, this is the strain you have, this is how you treat it, these are the kinds of things that you need to do for your public messaging, can be a huge help, but it's not always welcome. So the relationships that a country team has, whether it's the aid director or the ambassador, others, to persuade people that this actually is in their interest, even though the initial response might be to interrupt the film festival or something that's very important locally, but also advising CDC that there is this interest, there is this concern, and how do we address that? So bringing the local context into that decision making.
I also was just going to say Larry Summers, famous economist, has estimated that between now and 2050, the order of magnitude of disruption to the world, cost to the world, the number of trillions of dollars of terrorism, of climate change, and of pandemics are likely to be about the same. And we're rightly spending trillions of dollars to combat terrorism. We've pledged $1 trillion. I hope we can fulfill that pledge to combat climate change. But for pandemics and preparedness, we're spending less than $1 billion, even domestically, and overseas maybe $50–60 million a year, far below what we should be investing because of the return on investment. If we invest $1 million in preparedness, we save $100 million in response if there is an outbreak, or the outbreak we've prevented.
Because one of the things that strike me, there is a growing emphasis, and you may comment on this, on One Health, that we have to focus on animal health now as well as human health, because as people move, so do critters. You got bats, rats, birds, mosquitoes on the move and interacting with populations as well. So you can't really do one without the other, it seems.
I want to put in mention here of the Global Health Security Agenda, which very consciously, with the U.S. Department of Agriculture, USAID, which is in the lead on the One Health side, is looking at the potential outbreaks for which we're not prepared, and looking in particular at the zoonotic transmission from animals.
And in many places of the world, I happen to live in Delmarva now, where the chickens are pretty much contained in large facilities, but that's not true in most of the world. They would interact with birds that are flying over on migration routes, and the chances for a mutation to occur with the flocks of chickens and ducks and geese that are being farmed outside. And then all of a sudden, if you're not paying attention, you can have a spread of a new influenza that takes a little while. But again, that early warning by WHO, by the American Embassy, to really look at this, find out what strain it is, how do you treat it, is critical.
Yeah, and there's an irony here. These are inevitable. These outbreaks are inevitable, but they're also preventable. And we need to be tilting the balance toward the preventable side, and we need all of our resources, diplomatic and medical, to do that.
I think the conversations we've had, the conversations we've had with both ambassadors individually and together were very interesting, and there are some common themes that ran through the discussions. One is we're facing some serious problems in the future, and we have to deal with them. And we have to be thoughtful about that and provide the necessary resources to do it. Another theme that rings through is that the U.S., the United States, and the diplomatic community play a very big leadership role in pandemic diseases and the preparations for them and the response to them, and play a strong advocacy role with the United Nations and with other governments. And that the United States really does lead in these sorts of issues and has a history of leading in those, which is very important. And so I think if we remember those few points, that's important to what happened in the discussion. And now I have a little challenge for all of you. Excuse me. We would invite you to visit the Diplomacy at Risk website. And after doing that, send an email or call your congressman or your senators and advocate for a couple of issues. And one is for full funding for American diplomacy and for the U.S. State Department, and to urge our representatives to retain and recruit foreign service officers who will then be able to fill all the critical posts that remain vacant at the moment, and they'll be very professional and very well trained.